Patients with acid reflux don't necessarily have to live with reflux for the rest of their lives. Most patients think that if they have acid reflux, they have to stay on the medication, which is called a proton pump inhibitor, often things like omeprazole or Nexium. And it's a common myth out there that patients who are on this have no other treatment and they just have to be staying on acid reflux medication. Well, the reality is that even with the acid reflux medication, patients usually regurgitate the contents of the stomach, which means liquid still comes up, but it's not acidic anymore. Now, the problem with that is very often those things go into the lungs and they cause recurrent aspiration. But at other times, they don't necessarily go into the lungs, but refluxing the contents of the stomach is a problem by itself for most patients. And the reality is they don't have to live with this, because we do have minimally invasive approaches. That means doing procedures that will resolve the acid reflux in more than 95% of the cases. So we have very effective surgery for this. These are small procedures done laparoscopically, that means with the small incisions. We can also do it with the help of the robot, where we wrap the stomach around the lower part of the esophagus or the food tube. So by doing that, we create a new valve that prevents the acid from the stomach going into the esophagus. And patients don't have to be dependent on lifelong medication. Any medication prescribed for a long period of time, especially lifelong, has its side effects and has downsides to it. So I think that it behoves any patient who has acid reflux to come to an appointment with a surgeon who specializes in these kind of things and consider their options and weigh the risks and benefits of lifelong dependence on medications with continued regurgitation versus surgery that will control both, and they don't need the medication anymore. And there are many minimally invasive options. There's the magnetic band, which is the magnetic bracelet, which we call links. And then there's the fundoplication, which is where we wrap part of the stomach around the esophagus. I've been very interested in this surgery for many, many years. I've been doing this kind of procedure for about 20 years now. And I've been, by and large, very successful. My patients have been very happy with the results of these surgeries. So I encourage you to come and see me for this.